I'm just seeing 4 messages in the chat box, and there's over 16 of us on the call already. While we wait for others to join by 7, which is when we're starting, please, I want to reiterate that we should take the opportunity to connect, network, at least amongst ourselves. I see Aima Begon from Pakistan. Thank you for joining us, and specifically for joining this early. I see Hiba Ahmed from Sudan, a clinical pharmacist, and I see Patience from South Africa. Patience, welcome. It's been a while.
Thank you.
You're highly welcome. I see Aliu Ahmed from Nigeria. Let's keep it coming in, guys. Let's keep it coming in. While we wait for others, we'll be starting as soon as it is 7 p.m. GMT for fun. Okay, I see Loveness, a pharmacy technician from Zambia. Welcome, Loveness. I see Nuhu Prince from Nigeria. Welcome, Prince. Let's keep it coming in, guys. Let's keep it coming in while we wait for others. Aside introducing yourselves, you can also add the part of the program that excites you. If you've applied to be a country or a regional ambassador or a research ambassador or a digital ambassador, you can share with us what excites you, what the motivation was for applying for that track. Okay, I see Tanzila, this student from Pakistan. Welcome, Tanzila. I see Muhammad Ibrahim, veterinary medicine from Nigeria. Welcome, welcome. Hiba Ahmed says, we're excited to be here. Looking forward to raise awareness about pharmacogenomics locally and hopefully participate in the researches with the group to bridge the gap of genomic data in Africa. Yeah, I'm really excited about that myself, Hiba. There's so much that needed to be done in the field, and it just excites me and keeps me motivated and inspired when I see the energy that we get from participants. It really, really excites me. Let's keep it coming in. Let's keep it coming in, guys. Naomi. Naomi is a pharmacist from Kenya. We are honored to get the chance to learn more on pharmacogenomics and how we can use it to better our healthcare sector locally and internationally. Yeah, I share the same thoughts to Naomi. Thank you so much. Emmanuel Atubiga is a pharmacy student from Ghana, and you joined this program simply because you're interested in how genetics can improve cancer treatment and patient care. Using genetic data, we can figure out which drugs we can figure out which drug works best and avoid harmful side effects. I want to help raise awareness and promote safer usage of medications in the long run, not temporary, but permanent. That's nice. That's nice, Emmanuel. That's nice. I really admire your passion. Aliu Ahmad says, excited to be here. You're a medical scientist student from Nigeria, and you're looking forward in gaining mentorship and to participate in research with the group about genomics locally and globally. That's great. That's great. And Dan, a pharmacy student at the University of Rwanda, what excites you the most about joining the Pharmacogenomics Ambassadors program is the opportunity to be part of a forward-thinking community that is shaping the future of personalized medicine. Pharmacogenomics represents a powerful shift towards safer and more effective treatments, and you're inspired by the chance to help raise awareness and make this knowledge accessible to students and the public. We are particularly excited about collaborating with like-minded peers, gaining mentorship, and developing skills in science, communication, advocacy, and leadership. And being part of this leadership program would allow you to contribute to meaningful initiatives while growing into a professional who can promote the responsible and impactful use of genomic information in healthcare. That's amazing. That's amazing, Dan. That's amazing. That's really, really amazing and inspiring. I believe a lot more persons will be inspired by that. So it's just some seconds past 7 now, so we're going to begin the session officially. Yes, good evening once again, everyone. It's amazing to have us all here present, and it's the onboarding session of the PharmaGenoXfE Global Ambassadorship Program 2026. I'm very excited about this program, very, very excited. Um, since the time we sent out applications and people sent in their applications. We went through those applications, did screening of the applications, and now we have successfully screened and selected participants for this program. I'm very excited. I'm very, very excited. The very beautiful messages that were sent during the application were really, really heartwarming. It shows that our world, I would say, at least the healthcare world, is in safe hands. Having persons who are really passionate about advancing precision medicine is great good for the world. And today's session is going to be about setting us up for the journey ahead. With perhaps a good number of us here would have been very active in the webinar sessions we've been hosting since 2024. A good number of us, at least I can name a couple of persons here who has been with us, who has been attending those sessions. And for those persons and for the rest of us, I know and I believe strongly within me that you share that passion to make the healthcare sector in your country, in your region, in your local communities better than they currently are. And all we are doing here is about exploring those passions, about um, seeing how together with our collaboration, with our partnership, how together we can move and continue to raise the bar, right? We can continue to shift and continue to give even better practice to our patients in the healthcare space. So we're going to be moving straight now to the session proper. And before we delve into the session, I'd like to say some few things about housekeeping rules for today's session so that we don't have a rowdy session. And at the end of the day, we're going to be sending an attendance to everyone to sign, which is very, very important. It is very, very important that you take the attendance for today because it's part of the things that we would start to count from this moment. So do well to still to the end of the attendance, to the end of the session and take the attendance. If for any reason you're not able to take the attendance and you certainly had attended the session, please reach out to any of the coordinators. We're going to be introducing them during this session, so you wouldn't have any issues reaching out to them. We're going to be introducing all the coordinators and you reach out to them to ensure that you sign the attendance for today's session. It is very important. I have to say that. Now, for those of us who would like our videos to be on, in fact, I do encourage that you put on your videos. In fact, would have a time during the session that it would be recommended, highly recommended that all of us put on our videos just for some photographs, right? But at this moment, if you are encouraged, if you feel like you want to turn on your video, please feel free to do that. In fact, I'd recommend you do that so we continue to know one another, right? And then when you're not speaking, ensure that your microphones are turned off, except if you want to say anything, you would have the audience and you would have the opportunity to say whatever is it you want to say. Yes, that's it. We're going to get straight to the session now. And we're going to be beginning with a presentation about the onboarding session, about the expectations, about the do's and the things that we're not going to be allowed to do as far as the ambassadorship program is concerned. And of course, those things we're not going to be allowed to do are not like things that we would want to do and would be of benefit to us. No, they're things that, of course, would not be of benefit to any one of us. So when I say that, that's what I mean. And then at a certain time during the session, we're going to be having our chief coordinator talk to us. We're also going to be having one of our distinguished pharmacists talk to us today, just to encourage us, just to ensure that we have all the things that we need to carry on the journey. So I'm going to move straight right now to sharing my screen. I mean, a different slide, not this one. So I'm going to share that slide so we start the presentation. Okay. Is my screen visible? Can we see my screen? You can unmute and say something, please. You don't have to type in the chat box. I probably would not be able to see that now.
Yes.
Yes,
The
sir. We
screen is
can
on.
see your screen, sir.
We can see it.
Okay, great. Is it still showing the blue banner, or it's the white one slide?
No, it's not showing any blue. I know.
Okay, let me try to. Okay, yes. I'm sharing the right one. Yeah. Thank you so much. Okay, so I'm going to get straight to the presentation now. So if at any point any one of us have any questions or we cannot see my screen, please just unmute and say something, please. I don't mind. Just say something, because I am currently on the slide screen, so I'm not inside of Zoom. So I'll not be able to see your messages in the chat box, just to let you know. Okay, so welcome once again, everyone. It's certainly exciting to start this journey with all of us. And what I'm going to start to do today by this presentation is to take us through the program, what our vision is for the program, how we believe that you can contribute to the work that we've started, especially in taking that work to your local communities, your region, your country, and giving the message of precision medicine to everyone. So my name is Destiny Elogusa Ali. A number of us know me by now, and I am the founder of PharmaGenoXfE. And what we do at PharmaGenoXfE is not something that a good number of us do not know, which is that we promote, we advance pharmacogenomics, research, education, specifically capacity building, especially in this part of the world and other LMICs where representation is very limited. And the third thing that we do is engagement. Engagement with stakeholders, with policy makers, to ensure that we continue to speak the word, speak the message of precision medicine to each and every one of them, up to the point where we have it fully integrated. And we know that from all of the sessions we've been having, that there's been a lot of challenges to that. And in fact, the World Health Organization genomics reports released in 2025 even showed that there's even a bigger problem than we even thought. So the disparities are so huge that precision medicine is no longer becoming precision medicine for all, but for some selected few, especially for countries in high income regions. So that is part of the things that we've thought about and the reason for which we are starting this ambassadorship program this year, 2026. So welcome, everyone. It's not been easy. In the next slide, I'm going to show some statistics about the entire application and the selection process. So you see that for some of us, it's not really about how much we wrote in the form that was sent out, but we just looked for some specific things that we believe that persons who should be in the program should have some specific things, perhaps not even the qualifications or the big achievements. No, just some things that we believe that some persons should have, the persons should have who should be on this program, to know that our visions and our missions align. So welcome. Your selection certainly reflects that you have that ability to represent a growing research-focused initiative, right? So um, all it is we are doing in pharmacogenomics and precision medicine is centered around research, is centered around evidence, right? And it is on us to ensure that we put professionalism and integrity at the forefront, because that is what you want to do when you are doing research, right? When you want to give evidence, you have to ensure that you are you have integrity. You're reporting the correct details, the correct results you get in the lab. So those things are very important and are very central to the application process and the fact that you've been selected today. So a very big congratulations to all of us. So here on my screen is the total number of applicants. Not so many persons applied for the program. For a start, it's a huge one in my own view. We had 257 applicants from across several continents and several countries of the world. And you can see to my left-hand side the number of persons who applied and the persons selected. The acceptance rate was really not very, very high. And the reason for that is very simple. We're still a growing body. And as a good number of us would know, um, a number of us in the program at PharmaGenoXfE are still undergraduate students. In fact, the most of us are in our final year, right? So we're going to be graduating this year. And to be able to do something like this, hold an organization and still be in pharmacy school can be very challenging. And so we tried as much as possible to see how to reduce the acceptance rates, even though it was really tough for us to do that because there were so many beautiful applications, so many beautiful applications. So at the end of the day, we had to decide just to ensure that we have a pool of participants that we can work with effectively, because we believe that the most important thing is not about the number, it's about the impact that we are able to make. I believe you can still see my screen. If at any point you cannot see me, please do not forget to just unmute and say something. Okay, so this is just another representation of what we have. Are you saying something? Hello, can you hear me? Can you still see my screen?
Yeah. This is me, Aman Begum, from Pakistan. So, may I ask you, like, at what basis you categorize the country and the participants, like the percentage and the number of persons?
Sorry, I'm not sure I got that question. Ayman, please speak up. I'm not sure I got your question. Can you speak up?
Okay, so here you mention some countries and their a number of participants and the percentage. So I'm asking at what basis you categorize the country and the percentages, at what basis you categorize that things?
Okay, are you talking about the acceptance? Like what was the basis for the selection and all of those? Or are you talking about the categorization of the countries? Ima, can you hear me?
Yes, yes, sir. I mean, there is some participants like from different countries. So at what basis, like as you mentioned, Pakistan, Zambia. So there is some five participant. Then there is some three participant. So it is the number of participants or as a whole. And 100 it is five, or and 100 it is three.
Oh, I think I get your question now. Okay, so
Thank you.
I'm going to the earlier slide. So if you look at the earlier slide to my left hand side, you'll see the number of persons who applied. These are the applicants, and these were the number of persons selected. For example, in Nigeria, we have a total of 112 applicants, and then only 40 of those persons were selected. And the same thing applies to all of them that we can see here. For Pakistan, for example, we had 12 persons applied and only 4 persons were selected. And like I mentioned earlier, this was a very difficult decision for us to make. And we had to put into consideration a whole lot of things. And like I mentioned earlier, what was very central to that consideration were two very key things. One, the applicant's application in terms of what they had written out, how much hours they said they could um, 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 give per month, and all of those sort of things. And then our own capacity. Like I mentioned earlier, we were still a very small organization, and we want to try as much as possible not to make it about the number, but about the impact that we can give. Okay, so those are the things that we looked at in arriving at those selections that we have. Okay, I hope that answers your question.
Yeah, I got it. I got it. Thank you so much.
Thank you so much. Okay, so as we move forward, we're going to talk about next now the reason for which PharmaGenoXfE exists. Now, this is something that perhaps some of us have seen some aspects of it, which is that we have organized webinar series, we have organized educational um, 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 sessions where we invite speakers to talk about pharmacogenomics and precision medicine. That is an aspect of the things that we do. In fact, and for those of us who do not know, PharmaGenoXfE has three arms. The first arm is the educational arm, educational and capacity building arm. And that is the arm that is basically responsible for um, the webinars we've been seeing, the educational initiatives that we've been seeing, and basically around building capacity. So when we have during this ambassadorship program, we're going to be having some sessions specifically designed for ambassadors, and the educational arm is also going to be responsible for hosting and organizing those sessions. And then we'll have the second arm, which is the research nexus. Now, the PharmaGenoXfE research nexus is about research, right? About building capacity in research and actually conducting this research. So our philosophy is around the fact that we do not have to have the $5,000 grants to be able to do any research. No, we can easily do any simple research starting from our community. Simple research that we know that, okay, this project have not been done. Let's start it, right? So that is what the research arm does, which is the research nexus. And then there is the patient advocacy and stakeholder engagement arm, which is the third arm of PharmaGenoXfE. And that's the arm that's responsible for reaching out to policymakers, reaching out to hospitals, reaching out to institutions, seeking collaborations, making public statements about policies, about the healthcare space generally. So that is another arm on its own. And these three things, these three arms encompasses to a large extent the reason for which PharmaGenoXfE exists. Okay, so and one thing that is central to us at PharmaGenoXfE is the representation of underrepresented regions. And when I say underrepresented regions now, I do not mean just Africa. I mean countries even outside of Africa that are less represented in the pharmacogenomics and precision medicine space. Countries who have limited resources, countries who have conducted limited research in the field of pharmacogenomics and precision medicine. So all of these countries, all of these regions are very central to what we do. Okay, so what's the mission? What's the mission for PharmaGenoXfE? It's basically to improve healthcare outcome by promoting equitable integration of pharmacogenomics and precision medicine across Africa, LMICs, and beyond. So, like I mentioned earlier, this is very central to what we do. It is very, very central to what we do. And then we want to see a world where genomic-centered healthcare is accessible, central, evidence-based, and inclusive of all population. Okay, the core focus areas, which is what I had talked about earlier, I mentioned that we are into education and capacity building, research and knowledge generation, policy and advocacy, community and stakeholder engagement. So I won't spend so much time here, so because we've talked about it before. So you probably must have asked yourself this before now, that what do you stand to gain? What's the benefits, or what does it mean, for example, to be an ambassador of PharmaGenoXfE, to be in this global ambassadorship program? What does it mean for you? What does it mean for your community, your society, your country, your region? So let's see all of that. Now, as a PharmaGenoXfE ambassador, and when I say PharmaGenoXfE ambassador now, I mean as an ambassador representing PharmaGenoXfE in the area of precision medicine and pharmacogenomics, you are a direct representative of PharmaGenoXfE in your community. Now, this is very important because as ambassadors, you carry the mission and the vision of PharmaGenoXfE to your local community, to your region, to your country, to your state. For those of us who are joining here from Nigeria, and you represent PharmaGenoXfE's value. So the values that we hold very strongly, which of course, one of them is accessibility. So we try as much as possible to have sessions that are accessible to the population. Literally anyone can join our sessions. So you probably would have seen this in the webinar series we've been having. And the reason for this is because, of course, pharmacogenomics and precision medicine is a new area, and it's an opportunity to be able to make something for oneself. But bigger than that is the opportunity to impact, which is what we really, really hold strongly. And that is why for all of the sessions we've been having, we try as much as possible to make them free for everyone to participate, right? And even give some motivation as well, certificates of participation to ensure that you participate in the session and you're able to learn something from the session. So you represent the same mission and vision. And this is very important and very critical. The same mission and vision. So as an ambassador of PharmaGenoXfE, you embody that mission and vision which PharmaGenoXfE holds very dearly. You are involved in the advocacy for genomic-centered healthcare. So this is a statement that genomic-centered healthcare, advocacy for genomic-centered healthcare is a statement that is even very relevant in our world today, because we've seen that a lot of disease conditions, a lot of diagnosis of certain diseases are very, very related to the gene, the DNA of every human, right? So genomic-centered healthcare is an aspect of medicine that any one of us cannot run away from or cannot ignore. So we try as much as possible to advocate for the integration of genomic in our healthcare system. And so, as an ambassador, you are part of that advocacy. Now, you introduce pharmacogenomics to your community. Now, this is also very important because a good number of societies, a good number of countries, a good number of regions have little or nothing done yet about pharmacogenomics. So it is your opportunity, it is your responsibility that we're giving to you now, or that we are appealing to you now, that you carry on to that community, to that region, and to that locality. Now, being an ambassador of PharmaGenoXfE means a lot of benefits, a lot of opportunities, but there are limitations and boundaries that ambassadors should always take note of. There are limitations and boundaries that ambassadors should take note of, and some things that they should get very, very clearly. So that is why we've decided to have this slide. We understand that a good number of us know that, okay, we are not employees, ambassadors are not employees or paid staff. Ambassadors are not independent, emphasis on independent spokespersons who speak without approval. They are not. Ambassadors are not. And ambassadors are authorized, they are not authorized to provide medical advice or clinical guidance. Okay, so PharmaGenoXfE is not a clinical a company that deals in treatment, diagnosis, or prevention of diseases or infections. So we are largely a research and advocacy group, research advocacy and enlightenment or capacity building group. So you are not authorized as an ambassador in the name of PharmaGenoXfE to provide medical advice or clinical guidance. And this is not just in person. It doesn't mean that you would have to do that in person to somebody. No, it may be maybe when you make content, because we're going to get into all of those later. When you make content that you send to Facebook, to YouTube, in the name of PharmaGenoXfE, you have to ensure that you desist from providing medical advice or clinical guidance, because we are not to do that. And ambassadors are not free agents operating outside PharmaGenoXfE's policies. So we're going to have all of those policies given to each and every one of us at the end of this session. So we're not free agents operating outside PharmaGenoXfE's policy as far as this ambassadorship program is concerned. Now, what are your roles as an ambassador? For those of us who have been accepted, just to make it very clear, if you apply to be a country or regional ambassador, we recognize that you have your reasons for applying for such. So we've tried as much as possible to keep everyone that have applied for the different track into those tracks. So if you applied for being a country or regional ambassador, you are automatically, by virtue of the fact that you've been selected, a country/regional ambassador. So this part of the slide is very important to you. So what is your focus basically? Your focus is local outreach and institutional engagement. So that is basically what you do as a country or regional ambassador. That's an overview of what you do. And some of the core responsibilities that you have relating to this outreach and engagement is: one, you represent PharmaGenoXfE at approved local or regional events. So what does this mean? This means that there could be an event that when we go forward, you would see the areas about planning events and all of those. There could be an event that you've written proposal to organize or to collaborate with some organizations in your regions or your locality to organize. You partner with them and you organize the event. Now, you're going to be organizing that event, and throughout the duration of that event, you're going to be representing PharmaGenoXfE's interest in that event. And what is our interest here? Our interest is not that you come and always just speak about us, right? No. The interest here is that you carry the mission and vision of PharmaGenoXfE, which is to go out there and preach the message of precision medicine and pharmacogenomics to everyone. Largely, that is what it is. Okay, yes, it is very fine. It is very recommended that you mention or you state that, oh, you are representing PharmaGenoXfE. Of course, the events, flyers, or all of those would carry that. But what is most important to us is that you are giving and producing that impact into your community. You are giving back to your community, and you are expanding the field in your local or regional arena. That is very, very important. And then you support or organize local awareness activities, just like the PharmaGenoXfE educational arm does. You support or organize local awareness activities. So when I say support now, support could mean there is an organization that's organizing that event. You may now decide to partner with them by virtue of just supporting them to carry out that awareness. Of course, that is something. You could decide to organize the event yourself, or we could have it such that, okay, PharmaGenoXfE here is organizing that event, but that's PharmaGenoXfE at the headquarters is organizing that event, and we want huge reach in your locality. We want to get a huge number of persons in your locality join the sessions, join the events, and you support that effort. That is very important. That is one of your core responsibilities as a country or regional ambassador. And then the next thing is that you engage universities, hospitals, student bodies, and professional groups. This is where the engagement, right? Engagement, stakeholder engagement, policy advocacy comes in. So you can liaise with universities, you can partner with hospitals, with student bodies, with professional groups in your country or region to organize events centered around precision medicine and the healthcare space, right? And of course, all partnership and events require prior approval. That is very important. So we're going to share with all of us the mechanism by which we get those approval later as we move forward in the session. And then let's go to the research and academic ambassadors. So the research and academic ambassadors, your focus is an academic integration and research engagement. Academic integration and research engagement. So that is very important. We want to ensure that you are able to contribute to the academic space. You're able to contribute to the academic space, and you're able to be engaged in research activities within or outside your locality. You are able to participate in those, right? And some of the core responsibilities here include that we support donor clubs and academic discussions. So when I say support journal clubs now, um, that may not be very explicit. So I'm going to explain. So supporting journal clubs does not necessarily mean that there have to be a journal club already existing that you have to support. No, you could you could initiate. In fact, it is very recommended. We'll get to that. We'll get to the training of those in the research and academic ambassadorship track. We would have sessions for each of the tracks where you would where we'll talk about the different things that you can do, how you can start them, link you to persons that you can invite, and so on and so forth. Okay, so you promote pharmacogenomics literacy in academic settings. So when we talk about reaching out to schools, reaching out to hospitals as well, reaching out to professional bodies, basically, the Clinical Pharmacists Association in your country, the Pharmacists Association, basically, generally in your country. You want to reach out to them, you want to see how you can promote PGS literacy because one thing is very certain. Not every pharmacist knows about pharmacogenomics. Not every pharmacist or medical doctor or biochemist or nurse knows about pharmacogenomics and precision medicine. You know, I've shared several experiences on our webinar sessions before regarding my 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 experiences with some of my lecturers, some of my preceptors where I did my IT, right? And where I did my clinical postings. So not everyone knows about pharmacogenomics or precision medicine, even though they are in the healthcare space. So it is your responsibility to promote its literacy amongst this group of persons. Then you contribute to research awareness, abstracts, or collaborative initiatives. Now, um, this is something that is very, very important, very, very important. And as we move forward in the program, we are going to ensure that we give you all the needed support to be able to contribute to research awareness, knowledge generation, and collaboration globally, especially with global organizations such as Pharmacogenomics Global Research Network, which, by the way, is the largest gathering, the largest organization of pharmacogenomics and precision medicine in the planet. So we're going to try as much as possible to ensure that we support you in the ways that we can to have you contribute your research from your countries, from your region, to the pool of knowledge in the pharmacogenomic space. Now, no research may be conducted under the PharmaGenoXfE's name without formal approval. That is very important. That is very important. So if you are conducting a research, if you're writing, of course, before conducting a research, you would write a proposal, you want to do all of those, right? So while writing the proposal, you would submit a proposal of that research to the coordinator. So the coordinator that will be responsible for your region should have that proposal, and we should go through it. We should be able to see, okay, this is the research you want to conduct, and then we'll be able to support you in the best ways that we can. Of course, we'll get into all of that, into all the process of going through that, not in this session, in another session. Okay, let's move to the next. So we move to the digital and communication ambassadors. The digital and communication ambassadors, it focuses on public education and digital engagement. Now, we understand the place of digital engagement in our world today. In fact, it is very important. It is very, very important that a huge percentage of the population of the world today get their information from social media. So we understand that, and what we are doing in respect to that is to have these digital and communication ambassadors. And so by just saying this thing I have said, you probably have an idea of what your description of roles would be. So your focus is on public education and digital engagement. There are lots of misinformation out there. So what our job is to put in the right information into the public space. That is basically the focus of this track. And your core responsibilities include creating and sharing educational PGX or precision medicine content, promoting PharmaGenoXfE's events and programs. That is also very important, very important. Let me give us a perspective here. So these webinar sessions we are currently having, to ensure that we are able to capture everyone, to ensure that we have everyone on board, because the very first session, the very first series we had, I think in 2024, there was a lot of complaints about persons not being able to join the session, and that was because we didn't have a premium Google account, and so we're using a free Google account, Google Meet account. And so when it got to 100, nobody could join. And there were a lot of complaints in the chat box. When I saw the complaints in the waiting room, it really touched me that day. In fact, one of our program coordinator, Joan, mentioned to me that day that this was so bad because a lot of persons wanted to join, but they couldn't join. So they had the interest to join, but they just could not join. And so that was what motivated us to ensure that, can we hear me? Is if someone is saying the audio is off? Can we hear me, please?
Yes, we can hear you clearly.
Okay. So it must be from his or her end. So we saw that it was a struggle for some persons to join. And so what we decided to do for this session was to purchase a Zoom license. We had to purchase a Zoom license. And to be very frank with you, to be very, very sincere with you, as at 2-3 days to the start of this webinar series that we've started now, we didn't have the money for that Zoom plan. We didn't have the money for that Zoom plan. So it was just 2 days to a day to that some way some miracle happened, right? Some miracle happened, and we were able to purchase a plan to take 300 capacity. So the capacity that we paid for was 300, right? To be able to accommodate 300 persons. And I was still looking at the registration form, and I was like, this is not going to work because the number of persons that have registered were over 1,500 in the registration form. And for us to be paying for 300, I knew it was not going to work. So I thought, okay, let's put our YouTube channel, let's make our YouTube channel to be working, and let's try to be able to stream. So we streamed and ensured that we made the link available. If you remember, the very first day of the series with Dr. Zena, we had, I think the highest number we had in the room was 273 participants. And from that day, the number has been reducing, right? I think the last session we had was, we barely crossed 100 persons in the session. And what that tells me is that still a lot more persons are not aware about what we are doing. So if we had 1,500 persons register for the session, in that 1,500 persons, of course, we had over 270 persons participate in the first session, which has never been that high. It was high, but still yet not high enough, because we had 100, 1,500, over 1,500 persons register, and we're having just 270 in the session. So that was not good enough, and that is why this digital and communication ambassadors role is very important and strategic. So ensuring that people are aware, even after they registered for events. A lot of persons register for events and just forget about it, right? A lot of persons have this this habit of not checking their emails all the time, and they just forget about events. Perhaps when they remember, it's already 4 sessions gone, and they just feel there's no need attending again. So if we have this this body, this track to be which will be able to promote the events that we have, such as this webinar series, will be able to reach even more persons. And I believe that by the next webinar sessions we're having, we should be having 1,000 persons participating. That is not too much, but that is not enough compared to the number of persons who do not still know about pharmacogenomics and precision medicine. So I am saying this to ensure to let us know that for those of us who are digital and communication ambassadors, we have a huge task at hand to do. And that task is not going to be done alone. You're not going to do it in isolation. We are going to be with you every step of the way. And then your next core responsibility is to translate complex PGS concepts into public understanding. Now, this is probably the most important part, because I've had a lot of persons say to me that, Destiny, see, I've been attending these sessions, but I know they understand. I'm sorry about that. That is Nigerian pidgin English, right? For those of us who are not Nigerians. So what they are basically saying is that they've been attending the sessions, but they're not getting some of the things that the speakers usually say, especially when they start talking about those genes, those variants. You start mentioning CYP2D6, start mentioning CYP3A4, CYP2C19. They don't get it. So how do we ensure that we break these things into simpler things for them to be able to understand? That is where the digital communication ambassadors come in. So, like I mentioned earlier, you are not in this alone. We are in it together, and we'll ensure that we give you all the support that you need. All content must be properly branded and aligned with approved aims, mission, and the vision of PharmaGenoXfE. This is very important. This is very, very important. Like, I cannot overemphasize how important this is. Of course, we're going to even emphasize these things even more when we have the training sessions. Now, how long will the ambassadorship program be? So a couple of persons have asked me this earlier, but of course, during the application process, you probably would have seen that. A lot of persons would have seen that. So for this session, this ambassadorship program that we're having for this month, for this year, is going to be between 9 to 12 months. Now, you may ask, why not 9 months, or why not 10 months, or why not 11, or why not 12? Why not specificity? We're not specific because we understand that we could have, for example, this person organizing an event, for example, and planning an event takes a lot of effort. So it may span into this month or that month or next month, and so on and so forth. So what we are saying here is that this is the duration that we have. This is the minimum and this is the maximum. So at the end of this entire process, we'll be able to say to ourselves, we have been able to contribute meaningfully to the field of precision medicine and pharmacogenomics. So this is the span of the program. And then the time commitment is at least 2 to 4 hours per month. 2 to 4 hours per month. 2 to 4 hours per month. Now, this is another thing. 2 to 4 hours per month, at least, does not mean 20 hours per day or 20 hours per month or 5 hours per day. So what this basically means is that, for example, there could come a time where the only time you are supposed to reach out to or attend any event being hosted for ambassadors could just be once in a month. Yes, especially when we get to the second phase, from between day 30 and day 60, and between day 61 and day 90, right? And so forth. So during those times, the time commitment would continue to drop. But then what we're going to ensure to do is to give you that zeal, to give you that energy, to give you that motivation and inspiration to be able to go into your own community and do things, right? And not consider, oh, have I done more than 2 hours? Have I done more than 4 hours this month, so I should stop? No. So that is not I don't know if you understand what I'm saying. So my point here is that we are going to be having sessions at the ambassadorship coordination. So the ambassadorship coordinators will call for some sessions, and those sessions should not exceed these hours. We'll try as much as possible to make them not exceed these hours. But in your own localities, in your own community, your own areas, you can work beyond these hours. You can work beyond them. You have full permission and you're at liberty to do that. And for ambassadors, we are encouraged to have at least one tangible activity per quarter. So a quarter is 3 months, right? So one tangible activity per quarter, right? So at the end of the quarter, you should be able to present a report. We'll get to that very, very quickly. Now, these are the objectives of the program. The objectives of the program. Now, this could align with the tangible activity per quarter that you want to do. You could easily just take any one of them from here. These are examples, right? But the objectives are standard, they stand. But the things under them are examples. So for example, the objective one is to expand PGX awareness. Now, I'd like us to include precision medicine there, because I understand that some of us, or some persons at least, think that pharmacogenomics is precision medicine. Of course, if you attended the first session we had with Dr. Zena, you would know that is not correct. Pharmacogenomics is not precision medicine, and precision medicine is not pharmacogenomics. They are not the same thing. Pharmacogenomics, as a matter of fact, is a subset of precision medicine. Precision medicine is the umbrella under which we have pharmacogenomics, even though pharmacogenomics is a very key part of precision medicine. So expand PGX and precision medicine awareness. An example of that is support or organize at least X educational activities across regions. So X represents a number. It could be 5 educational activities across your region. It could be 10, it could be 50. What is important is that you are able to impact, you are able to contribute actively to the field. Another example is to reach at least X students, 5 students, 10 students, 50 students, 1,000 students, professionals or community members. Objective 2 is to strengthen academic and research engagement. And an example of thing we have there is facilitate journal club, research discussions, or writing support sessions. And we have another example there. Objective 3 is to build digital and public engagement. We have the examples there. Publish or support at least X educational posts, webinars, or campaigns. Grow coordinated visibility of PharmaGenoXfE across platform. Strengthen the ambassadors network. This is very important. Now, this 4th objective is probably the most important, because we believe that in unity, we can do more than we can in isolation. First of all, that is the reason why at the end of today's session, we would see those of us who have been put into specific regions. We believe that those persons who are together, if we come together as a network, we can do more than just having one of us or just two of us working together. So we ensure at least X percentage reporting compliance for this strengthening ambassadors network, and then develop at least X senior or lead ambassadors. So at the end of the day, you could have for your particular track or from a particular region, you could have 5 senior ambassadors or 5 lead ambassadors, and so on and so forth. Then each ambassador is expected to align their 30, 60, 90-day plan and quarterly activity with these cohort objectives. So these cohort objectives that are listed here are very important. So for each of the activities you're going to be carrying out, it should be aligned to these objectives. And the 30, 60, and 90-day plan would be seen later. I'll talk about that later. Now, these are examples of tangible activities organized or contribute to an approved gathering of educational purposes, contributing to webinar or discussion sessions, creating and publishing an educational post or article, assisting in the process of finding and enrolling individuals for research or programs. That's another very important thing. So here comes the code of conduct. As ambassadors, you are expected to maintain a high level of professionalism, integrity. I mentioned these 2 words on the second slide. That's to tell you that these are things that are very important to our values and to what we do. So as much as possible, we try as much as possible to maintain high level of professionalism, integrity, and ethical conduct. This is very important. Ambassadors must act with honesty and integrity at all times. Honesty and integrity is very important. It will serve us well if you are honest with us than not being honest with us. Because at the end of the day, when the chips are down, being dishonest would not serve any one of us any good. So being honest would really, really make sense. And by being honest here, I mean to our abilities, to our weaknesses, to our strength, to the activities that we do, to whatever happens at all, right? So that is very important that we put into consideration. Avoid harassment or discrimination of any kind. Avoid harassment or discrimination. One thing that we stand for at PharmaGenoXfE is diversity. Diversity. We are very inclusive. So we try as much as possible to accommodate everyone. And you see that evident in all of the things that we do. So we try as much as possible to desist from harassment or discrimination of any kind, And then another thing here is that you seek approval before any activity relating to PharmaGenoXfE. Seek approval before any activity relating to PharmaGenoXfE, relating to the ambassadorship program generally. Okay, so that is very important. And then you avoid misleading or defamatory posts. That is very important as well. So we'll get into the details of all of that later. So let's move to the next slide. Okay, so how do we deal with misconduct? How do we deal with misconduct? So failure to adhere to the code of conduct may result in one or more of the following. And The first one we have here, which happens in succession from top to bottom. So the first is formal warning. If there's any misconduct, there will be warning, and of course, we'll try as much as possible to make our own investigations, and there'll be temporary suspension if that persists, or we see that it's something that is not in our interest or in your interest as well, and then withdraw from the ambassadorship program if that is what it may come down to. Okay, so we're encouraging all of us to abide by the code of conduct. It is very important, just as it is important to the scientific community, to the growth of the scientific community. It is also very important to what we do at PharmaGenoXfE. So I would move on to the ambassador's playbook. So I'm going to be talking about the 30, 60, and 90-day plan. Now, if you look at this description here, you see that there's a 30, there's a 60, and there's a 90 days plan. Now, the first part, the 30 days plan, is basically to learn. This is where we build capacity. This is where each ambassador, starting from today, is expected to learn the things they are supposed to do, are supposed to learn more about the ambassadorship program, which, of course, this information will be provided. You're expected to build capacity in pharmacogenomics. All of these resources will be provided to you starting from today. So starting from today, we're going to be counting to 30 days. So at the end of the 30 days, you begin implementation. So that's the part where you have the implement 60 days, right? So at the end of that 60 days, that's cumulative now, at the end of the 60 days, you would have the next session where you optimize, where you basically okay, you get your reports, you do all of those sort of things. So we're going to get into all of those details. So this is the roadmap that ensures you are engaged from the very start. So from today, we're going to ensure that you are engaged and you have something that you already have planned that you can do. In fact, if you've been following this session very, very keenly, you probably would know on top of your head already what you should do starting from tomorrow, by the way. But it is important that you get to learn first. You get to, and by learn now, don't get me wrong, I do not mean, in fact, I understand that we have even PhD holders here. We have very, very, very great people here. So what I mean by learning is to learn about the ambassadorship program, okay? So for example, at the end of this session, we're going to be presenting all ambassadors with the link to a Google Drive. And that drive basically contains the entire toolkit for the ambassadorship program. So there'll be a section for you to read some things up first, so you know whom to reach out to, when to reach out to, or whatever, where to submit your reports, all of those sort of things, right? Templates for creating flyers, for creating all of those sort of things, you have them given to you. So that's the part, that's the thing I'm talking about when I say to learn more about the session, about the program. And so the playbook continues. So the first 30 days will be orientation. And this orientation is going to be multi-dimensional in the sense that it's going to take your efforts. It's also going to take some effort from us as well. So we're going to have sessions, orientation programs designed specifically for you. And you're also going to, on your own part, go through the files and the drive that we're going to give to you, the resources that we're going to give to you to ensure you get yourself acquainted with the program. So you are expected to study the ambassador's toolkit, which will be provided. I mentioned that earlier, and other provided resources. You attend all orientation programs designed for you. You identify a feasible activity aligning with your ambassador track that you would do. Okay, so you're expected to submit a report highlighting what you plan to do in the next 60 days. Mind you, you can see this is not at the end of the 30 days, at the end of the 60 days. So you must have implemented before that. So you see, implementation is 60 days. Okay. So let's move to the next slide. Now, these are examples of typical actions, that you could carry out that would be you could carry out during this 30 days period. You will attend onboarding, which is what you are doing now. After attending onboarding, you finalize your 30, 60 day, 90-day plan. So those of us, we are attending the onboarding session now. The advice is that after the onboarding session, you should be able to finalize your 30, your 60, and your 90-day plan to be able to identify partners, departments, or platform you can work with. Okay, I mean, these are organizations out there that you know you can work with, or you want to partner with, or you want to collaborate with. Very feel free to do that. Provided, of course, you know, we mentioned earlier that these must get approval. So it means you must communicate with the coordinators who would be introduced soon. And select your first activity. Let's say, for example, small awareness talk, online post, journal club, webinar, sessions, or so on and so forth. Okay, then the next 30 days, so that's like the 30 to 60 day, right? Between that 30 to 60 day is your active contribution and engagement, expected to implement the approved activity that you've planned. Okay, expected to document the outcome of being an ambassador. Okay, your outcome of the program you've planned and you've implemented, you're expected to document all of this. Then communications/partnership with other ambassadors. This is very necessary. Of course, it is very encouraged that we communicate and partner with other ambassadors, especially those not in our region. But of course, those of us in our region would be working together very closely. Yeah. Then the 61 to 90 days is impact building. Expectations include you complete at least one additional contribution or follow-up activity. You submit a short summary report on a quarterly basis. Then you participate in check-in sessions. So there will be check-in sessions for all ambassadors to ensure that we are constantly following up on your activities, supporting you in whatever ways that we can. Okay. At the end of the 90 days, each ambassador's contribution will be reviewed. Each active ambassadors will make it to the next term and may be considered for leadership roles. So that is very, very important as well. And from the amazing set of persons I've been seeing in the chat and the persons I've been seeing in the participants session, I know that a good number of us, if not all of us, would certainly make it to this point. So reports is another very critical aspect of the ambassadorship program. And this is just a thing about what ambassadors are expected to do. So ambassadors are expected to submit one report per quarter. So there are 4 quarters in there are four quarters in a year in the 12 months period, depending on how long we have it. We mentioned earlier that we could have 9 to 12 months. So depending on that, so you're expected to submit one report per quarter. And then okay, I'm seeing someone ask a question. We're going to take all of those questions as soon as I finish this presentation. So just sit tight, keep dropping the questions in the chat box. I really appreciate them. Reporting is designed to be self-reflective, simple, and honest. Again, the word honest is coming in here because we have to maintain professionalism and integrity, which is what our field is built on. So reporting include ambassadors, information, activity conducted, impact and reach, and the plan for the next quarter. Of course, the template for reporting, everything you need basically is on this drive. We're going to be sharing the drive with you later. The template for reporting, very simple template to ensure that we don't make things complex for anyone. And at the end of the day, we are able to do things very easily and seamlessly. So the next part is the digital access and resources. Digital access and resources. As an ambassador, you have access to the following: the brand logo, the email signature template. Okay, so we're going to be giving an email signature template for ambassadors, in case you're reaching out to anybody to partner with them. Of course, you should reaching out to them with the right branding, and that's why it's necessary that you have the email signature template to do that. And then the flyer and slide template, social media content template, as necessary. All of these again are on the drive, and you'll be getting access to the drive, exclusive access to that drive as soon as we end the session. So this is just kind of like a map of the drive, right? A map of the drive. This is a map of the drive. And if you look here, you see that it says what goes where. Okay. So the first thing that you see on the drive, when we open the drive, I'll probably do that later. But the first thing you see is this README first. So inside of this README first, you see the rules, the guides, and how to use the drive. You see a document on how to use the drive inside of this README first. And the names on the drive are the same as we have them here, the same exact, of course. Then we have the program governance, the toolkit, the agreement, the policy, the program structure. You see that there as well. Then the brand assets, where you have the logo, the template, you can easily download them, the brand guidelines. Then the onboarding, which is going to contain this, for example, this slide. I'm going to be uploading this slide there to that onboarding folder. We would have the first 30-day guide. We have it there already in that folder. And then the activities and events. So event proposals, reports, attendance sheets, photos, budget, and so on would be in this folder. So for example, the photo we're going to be taking at the end of this session, all of us, is going to be uploaded straight to that drive. And then you have the reporting and impacts, quarterly reporting template, and submitted quarterly reports. So there's a folder inside of this reporting and impact folder that is for the template for reporting, and there is another folder for submitted quarterly reports for each of the regions. Then we have communication and media, but this one basically has messages, guide, caption, press kits, FAQs. This is not very important, but just to ensure we get some level of consistency. Then training and capacity building. Now this one is going to contain training recordings. So because the sessions we're going to be having with participants, will ensure to record all of them so that you can always go back to them and review them whenever you want to. Okay, the slides would use, including this one, would be uploaded there. The reading materials, including resources that you can easily read and learn more about pharmacogenomics, will be there. Then there is this admin, which is restricted to the coordinators. Okay, as restricted to the coordinators. And then internal and sensitive documents for core team members only, okay? So you're going to see that there, but you may not be able to access that. And then we have the archive where we'll basically be uploading the old, retired, or cohort materials. Now, the golden rule is that if you are unsure where something belongs, that is, you want to upload your report, or you want to upload a flyer, or you want to upload anything at all, do not guess. You must ask the program coordinator or your regional lead before uploading. So we do not have regional leads yet. But at the end of this session, we are going to put in mechanisms. We're going to put mechanisms in place to have that bettered. Okay, so let's move on. So who to contact for what? This is another session that is very important. So this is very important because it helps prevent confusion, delays, or overloading of any single person. For example, you cannot contact the coordinator, the coordinator directly as an ambassador for very minute things as simple as the things you can easily get on your you can easily settle with your lead ambassador or regional ambassador, regional lead ambassador. So to ensure that we do not have one single person overstressed or over labored, we are ensuring that we have this who to contact and for what section in that folder. You're going to see this whole thing in the drive as well. So the first one here is your primary contact roles. So you contact the program coordinator, the ambassador program coordinator, for questions relating to the onboarding. For example, there's anything we say here and at the end of the day you don't get it, please contact any of your programs coordinator. Of course, the program coordinator would be assigned to, of course, that has been assigned to different regions, and you would see that later. Then, for reporting deadlines and issues, of course, you contact the ambassador's program coordinator. For assessing or permission problems, you can't access the drive or whatever is the issues, you contact your program coordinator. For general program questions, of course, not just any questions now. If it's a question that you can easily liaise with your regional lead on, please do that. We greatly encourage you to do that because, like I mentioned earlier, a lot of us who are the programs coordinator are also students. Okay, so we have so much doing as well. And then you can contact the regional lead. You should contact the regional lead for local coordination activities. So activities that you want to coordinate in the local level, please contact your regional lead. Your regional activities, supports with organizing events, local conflicts or misunderstandings. We are human beings. We understand that conflict is something that sometimes may be inevitable. It is how we manage them that is very important. So we could disagree, but if it gets into misunderstandings, please contact your local or regional lead. Except it's something that is very serious, then you bring to the core team, which is the third part. You contact for partnership and external organization. So if you're partnering with external organizations, you have to contact the core team. Okay, and we're going to, of course, define all of this to you later, what the core team and leadership means and all of those. And for media or institutional representation, you contact the core team. For serious conflicts or disciplinary issues, you contact the core team. For strategic proposals or new initiatives, you contact the core team. Okay, so that is very, very important. That is very, very important. So what not to do? You must not bypass your regional lead for routine matters. Please don't do that. You do not message the founder or call leadership for operational or routine issues. You do not use personal channels for official matters when official channels exist. These things are very important so that at the end of the day, we do not have anybody overstressed or overloaded with responsibilities, please. Thank you so much. So we'll move on now. So what are the benefits? What are the benefits of being a PharmaGenoXfE ambassador? What are the benefits? You may have asked. Let's dive right into it. Okay, so we have a lot of benefits actually, but I'm going to state these ones very, very keenly. So the very first one we have on top is personalized professional mentorship, right? Personalized professional mentorship. So at a point in this ambassadorship program, we're going to be having a mentorship session. Should I say session now? Not a session, a mentorship phase. Yes, that's the word I should use. A mentorship phase where we would link mentors to mentees. So and these are going to be, of course, persons in the precision medicine space as a whole. Okay, so persons in the precision medicine space as a whole who would mentor the different ambassadors. And before that time, we're going to be sending out some forms to get your personal perspectives on what areas you would want to delve into. If, for example, you want to delve into pharmacogenomics of cardiovascular health or cardiovascular pharmacogenomics or precision oncology pharmacogenomics or precision oncology. So these different areas, we try as much as possible, to do all within our power to support you in having these mentors who could help you, whether in the areas of research or what have you. And exclusive access to advanced training / certification programs. So very soon, we're going to be having advanced training and certifications at PharmaGenoXfE. And for ambassadors, that is going to be exclusive access. So while other persons may be required to do some things to get into these courses, for ambassadors is going to be exclusive access to these programs and courses in precision medicine. And then publication opportunities. So there is the opportunity to contribute, to be co-authors on articles alongside program leaders, which would be published in respected scientific journals. And then there is the leadership development track, stepping into regional coordinators role, and so on and so forth. Then there is the recognition, LinkedIn spotlight, recommendation letters. Sorry about that. Endorsements from the program leadership. So these are some of the benefits that you get being an ambassador of PharmaGenoXfE. And then others include certificates of contribution. Of course, this is going to be at the end of the program. And then there is the visibility that the program gives to you during our sessions, our webinar series. In fact, I'm very tired of moderating sessions. So we're going to be having persons, ambassadors step into this role to moderate sessions, to host events, and so on and so forth. So that's going to give us some level of visibility. The networking and collaboration is another aspect which I think is very, very important in as far as this field is concerned. And then PharmaGenoXfE recognizes ambassadors based on consistency and commitment to the program. Eligible ambassadors may advance to senior ambassador status, ambassador team lead, or other committee positions as needed. So in our respective regions, we may be having at some point committees to head certain activities or certain initiatives, and we'll be pulling from these from the ambassadors program to head these committees. Each ambassador's contribution and professionalism informs decision and selection process. So advancements are not automatic. That is very important. They are subject to the need of the organization. And then we look at the agreement, the ambassadors' agreement. So all ambassadors are required to acknowledge at the end of the first 30 days of the program expectations, the code of conduct, the brand and ethics guideline, and the data use consent. So all of these have been uploaded to the Google Drive. So remember I mentioned earlier that the first 30 days are for you to basically settle down and learn about the program, right? So, and this is not something that will take like 30 days per se, but we are putting 30 days to ensure that even if you're a busy person, you can only give 1 hour per day. You should still be able to do that. But if you can only give 30 minutes per day, you should still be able to, at the end of the 30 days, go through the entire thing and be able to get out policies, get out programs that you're going to be carrying out from that 30 days onward. Okay, so this is putting all of those persons who may be very busy into consideration. That's why we have 30 days. So if you see the drive, the documents are very short. In fact, majority of the documents are just bullet points, 1 page. So you just look at it in 5 minutes, you are done. Okay, so but very, very important that you go through them. So we've come to that point where we would be announcing to us our various coordinators, our regional coordinators for this year's ambassadorship program. And as you can see, the lead ambassadors column is still blank. So we're going to, like I mentioned earlier, get into the mechanism to put in a mechanism to have these lead ambassadors as soon as possible. But for now, we do not have lead ambassadors, and I'm sure that, like I mentioned earlier, we will do that very soon. So I'm going to be calling on our coordinators now. You can see my slide. On top here we have Blessing Chiamaka Udume, who is the coordinator for the region Oceania, North Africa, and Americas. So that includes, of course, New Zealand is the Namibia from North Africa, and then Americas, we have the United States of America. Okay, so we decided to put this together because, of course, we had, I think, the least number of selected participants from this area. So we just put all of them together here as one. Okay, so that's the coordinator, Blessing Chiamaka Udume. I don't know if she's on the call right now. Is Blessing on the call? You can just say hi to us. Just introduce yourself. We're drawing close to the end of the session now. If you're on the call, Blessing, you can just unmute, and yeah, if you can put on your video, very fine. If you cannot, that's also very, very fine. Okay, I'm not sure Blessing is with us. So I'll just go on. Perhaps she's with us and not able to unmute or whatever. So the next person we have on the list is actually our chief coordinator for this program. You probably would have seen this name before. For those of us, of course, all of us here, because all of us selected, would have gotten email from this person. Mary Jane Oriaifo is the chief coordinator, and she's going to be talking to us just very, very briefly this evening. Mary Jane, are you on the call?
Yes, good evening.
All right, please go ahead. You can talk to us, please.
Good evening, everyone. My name is Ora from Mary Jane, and I'm the Chief Coordinator. Please, can everybody hear me?
Yeah, we can hear you loud and clear. I can hear you from my end.
Okay, I'm the Chief Coordinator of the PharmaGenoXfE Ambassadorship Program. And I just want to say a big congratulations to all the ambassadors that have been selected. Your selection reflects our confidence in your ability to represent a growing research-focused initiative in pharmacogenomics and precision medicine. PharmaGenoXfE exists to advance pharmacogenomics and precision medicine through education, research, advocacy, and community sensitization, as Destiny had said before. You're not just joining a program, you are joining a growing movement in genomic-centered healthcare. As PharmaGenoXfE ambassadors, you are representing our mission, and I'm very sure Destiny already talked about our mission, our visions earlier. You advocate for pharmacogenomics in your communities. You create awareness and contribute meaningfully within your assigned tracks. And active ambassadors and committed ambassadors will be considered for advancements in leadership roles or senior leadership roles based on your impacts and professionalism. So as PharmaGenoXfE, we recognize efforts, and I really urge everyone to be active ambassadors, always be available whenever we call for sessions like this, and always make sure you are always engaged. Thank you for stepping into this role. I look forward to working with each and every one of you, and welcome to PharmaGenoXfE. Thank you.
Okay, thank you so much. Thank you so much, Mary Jane, for that wonderful one. So Mary Jane is our chief coordinator, as we've mentioned earlier, and she also doubles as the regional coordinator for East Asia and the Middle East, East Asia and the Middle East. So that includes India, Pakistan, Malaysia, and Saudi Arabia. So for those of us in that region, that is our coordinator. So she's the person you're going to be communicating with. And the route with which you're going to communicate with her would be shared with each and every one of us at the end of this session. So between now and 24-hour time, we will drop all of those details in the WhatsApp chat. So the emails with which you can reach out to each of these, your coordinators. And then next we have Francisca Innocent. Francisca Innocent is the regional coordinator for East Africa. And that includes Kenya, Rwanda, Ethiopia, South Sudan, and Tanzania. I don't know if Innocent is on the call. Innocent, are you on the call? You can unmute and say something, please, if you're here. Okay, perhaps she's not. So we're going to be dropping her email, the email with which you can reach to Francisca Innocent on the call, on the WhatsApp group, like I mentioned earlier. And then we have Joan Emetitiri. Perhaps a good number of us know Joan already. She's our publicity chairperson at the PharmaGenoXfE Educational and Capacity Building Arm. So you probably would have seen her dropped messages regarding the sessions, the previous sessions we've had, or you probably may have even had discussions with her before now. So she's the regional lead. She's the regional coordinator for West Africa and Central Africa. So you can see West Africa too, because of course we have some other West African countries below. For example, Ghana, Nigeria, they're West African countries, but just a West African too, and Central Africa. That includes Sierra Leone, Gambia, Cameroon, and Zambia. So if you are from any of these countries, that is your coordinator. And like I mentioned earlier, we'll be dropping the link to reaching her, the link to reaching her. Yes. I don't know if Joanne is on the call. Joanne, are you on the call? If you're on the call, please, you can just unmute and say something. Okay, okay. So we'll move on. We actually have, okay. We actually have a test tomorrow. So my class, the 600 level class, we have a test tomorrow, and of course, a lot of them might have gone to study for tomorrow's test. So that's very understandable. And then we have Eze Chibuzo. That name is misspelled here. My apologies for that. I'll correct that before uploading to the drive. So Eze Chibuzo is the regional coordinator for Ghana. So Ghana has a lot of selected applicants and a lot of applicants as well. So the high amount of applicants translated into the high amount of selected participants. And we have people from Accra, Bolgatanga, and Kumasi, and so on. So all of these persons from Ghana, Eze Chibuzo is your regional coordinator. So if you're in the call, do well to put that at the back of your mind, and we'll be dropping the link with which you can speak to him after now. Is this the Chibuzo on the call? If you're on the call, please just drop a message in the chat box, and I'll call on you to say something after now. Then we have Naomi Oko. Naomi Oko is the regional coordinator for Northern Nigeria, and that includes not only states in Northern Nigeria, because of course we have Abeokuta, we have Ibadan, we have Ile-Ife, we have Ogun State. These are not core northern states, but we've included them to ensure that, like I mentioned earlier, we have everything evenly distributed, even though it is still not evenly distributed, but to be able to just maintain some level of that. So people from Abeokuta, Abuja, Borno, Kaduna, Nasarawa, Kwara, Maiduguri, Zaria, Sokoto, that's your regional coordinator. I don't know if Naomi is on the call. Naomi Oko, are you on the call? Please, if you're on the call, you can drop a message in the chat box, and then I'll call on you to say something. And then we have Princess Chioma, who is the regional coordinator for Southern Nigeria. And that includes areas like Lagos, Awka, Benin City, Calabar, Ekiti, Enugu, Imo, Abia, Nsukka. I think that should be part of Enugu, right? Owerri and Port Harcourt, as well as, yeah, that's Rivers State. So yeah, so these are the coordinators for each of these regions. And I don't know if there's any one of us here whose region has not been mentioned. Please head on to the chat box now and drop your complaints, because that would be like so much oversight. Please, if there's anyone whose region has not been mentioned, please do well to drop that in the chat box. Now, thank you so much for being part of the Global Ambassadorship Program. Patience, my goodness, Patience. How could I have done that? Patience, I'm very sorry. South Africa, yes. And you can imagine, so sorry about that, Patience. We're going to work on that and try as much as possible to get that sorted out before 24-hour time, so that we can keep you up and running. I hope that is fine, Patience. How could I have forgotten that? That was so much oversight. Okay, so if there's still any other person who's here and the region has not been mentioned or the country has not been mentioned, please do well to help us know that, of course, we are humans and we make mistakes. So thank you so much. I would like to take our questions now before we call it a wrap. This is very important, very, very important that we ask questions. So I'm going to be heading straight to the chat box now to take our questions. Okay, so I see a couple of messages here. Let me start from the top. So I see this one from okay. Okay, I think the question starts from here. So I have a question. The presentation slide will be sent to the group. Yeah, the presentation slide will be sent to the group. We sent to the group, yeah. Sheda. I'm sorry if I mispronounced that. I'd like to volunteer for research ambassador. Yeah, Hiba Ahmed. Yes, sure. We certainly can always talk about that with your lead coordinator, with your coordinator. Yeah, I would certainly give you the microphone very soon, the audience to speak. So I'll just try and take the questions here inside of the chat box first. Am I the only one? Okay, that's not. Is there specific template for the report? I think I mentioned that. Yes, there's template for the report. That's on the Google Drive, and I'll share that now before we. In fact, I'll share that now with us before we go. Probably just navigate it a little bit. And then I have class tomorrow, and I'm still here. Oh my goodness. I'm a big gun. Yeah, I'm going to be dropping the attendance now. About the activities, are we only supposed to come up with them individually, or people from one country can collaborate and facilitate the activity? Yeah. Now, Nash, what is important is that we are able to support one another. So what we believe in is that no man is an island, no man knows everything, no one knows everything, right? If there's any activity that you have in mind, you can write it out as a proposal to the coordinators, right? To the coordinator of your region, and then they would put it also, they will put it to the core team members and we'll look at the program. If it's something that would require you to collaborate with regions outside of your region, right? In fact, if it is something that we would recommend that you collaborate with them, would liaise with you on that, and we would have that sorted out. Yeah, thank you so much, Sheda. Thank you so much. Okay, I think that's all. So while I go to get the attendance and the link to the drive, we can ask our questions. I think I saw some hands raised earlier. So if you have any questions, please, this is the perfect time to ask your questions. Let me get the attendance. So please, you can ask our questions, so you can unmute. Please feel free to unmute and ask your questions. Oh, wow.
Hello.
Yeah, I can hear you.
So, yeah, I have a request, especially for Miss Zinia, that because I really like her, the way she interact with us. So it's my humble request that whenever you arrange a session of Miss Zinia, so kindly arrange double session of her because I really like her.
Okay, you're talking about your regional coordinator, our chief coordinator, Mary Jane. Did I get you correctly? Were you referring to your regional coordinator, Mary Jane?
Yeah, Mary Jane, yeah.
Okay, great. Yeah, no problems.
So, Destiny, I wanted to ask about the live check-in sessions. How often will they be? Will they be weekly or monthly?
Certainly not weekly. That is something that what we are looking at is to have it such that the very next session we're going to have with each of the ambassadors is going to be about discussing what we can
Okay.
do and what we cannot do. Okay, it's going to be
Okay.
about um, how much, for example, okay, how often, for example, do we want to make it be? Okay, so it's going to be
Okay.
about discussing all of this. So at the end of that meeting, we're going to come to agreement on all of these things so that no one is going to be forced to do anything. Okay, everything we're going to be doing will be from our own motivation, internal motivation or intrinsic
Okay.
motivation.
Great. Great. And for the learning phase, the 30 days learning phase, is it self-based learning? Like, are we supposed to just push ourselves forward with familiarizing ourselves with the project, or there will be a certain materials that we need to look at and learn from?
Exactly. So there is going to be a combination of those of the two. So
Okay.
like I mentioned earlier, there are some materials that has been uploaded to the drive that we're going to be we're required to look at, to look through. We're going to be having also some sessions that will be organized specifically to help us with some basic things, right? Um,
Great.
exactly during this 30 days period.
Okay, amazing. That's exciting. It's nice to have something to base on, and then you can build on it, definitely.
Great, great.
Thank you.
You're welcome. So if you have any questions, please feel free to drop them. Feel free to drop them. Um, Feel free to drop them. You can unmute, please. Just unmute rather than dropping them. Please unmute.
Kindly, Destiny, will you please drop the attendance sheet here because some of us are not on YouTube. We are attending via Zoom.
So I'm going to be dropping the attendance link now. And I'm also going to be dropping the link to the drive on in the chat box, and we just take um, some of those, and then we'll get on. Okay, so that's the link. Yes, I'll send the presentation slide. I just dropped the link now to the attendance on the chat box. Thank you so much. Thank you so much, pharmacist Esther Echo. Thank you so much. Thank you so much. Thank you so much. Thank you so much, pharmacist Ifeanyi Akpe. Thank you so much. Thank you so much. So I did mention at the start of the program, I wasn't certain if our distinguished pharmacist was going to join us, but it's so much privilege to welcome and introduce to all of us a very distinguished pharmacist, a very distinguished clinical pharmacist who's been very instrumental to the putting together of this program, encouraging us at PharmaGenoXfE. He has been a father, he has been a teacher, he has been a mentor, just name it. So, ladies and gentlemen, just for some few minutes, I'm going to be bringing to the microphone this amazing, distinguished pharmacist who, like I mentioned earlier, has been a father, a mentor, to say a few words to us. So, pharmacist Ifeanyi Akpe, please, if you do us the pleasure, please, would like to hear from you this evening. Thank you so much, sir.
Yeah, hello, good evening, everybody.
Good evening, sir.
Yeah, it's such a pleasure and an honor to actually join you today. There's one of those days that actually gives me joy, having known Destiny for a few years and finding out, getting to know his desires and his wishes to push this through. And I am so elated that this is actually taking place today. And I'm happy and trying to say a big thank you to everybody who's volunteered to get involved. What you're getting involved in today, from what I see and from what I actually envision, is going to really grow to something very great. And those of you who are the ones who are going to champion this, I believe you're going to be leaders in the world of healthcare wherever you find yourselves. So I hope you will put in your best, because I know that at the end of the day, it will be beneficial to you and to all of humanity. Thank you, Destiny. Thank you, everybody. And I'll always be here to support you in everywhere I can, learn with you, sweat with you, grow with you, and applaud all of you wherever you may be and whenever you will achieve whatever little successes I believe and I know all of you are gonna achieve. Thank you for this time. I know it's pretty late. Thank you so much for this opportunity, Destiny. And I'm always available to come on at any time. Thank you so much.
Thank you so much, sir. Thank you so much, sir. We're very grateful, very grateful. You've been so much motivation, encouragement, inspiration to us over the years. And those words you used to speak to us, they continue to echo in our minds, in our brains, to ensure that we continue to push forward. So we're very grateful for the opportunity to be able to be privileged to learn from you and to benefit from all that you've done. Thank you so much. Thank you so much, everyone. Like I mentioned earlier, we're going to be dropping the link to the drive in the WhatsApp chat group. I'll drop the link to the drive in the WhatsApp chat group. And if you have any troubles navigating the drive, like I mentioned earlier, reach out to the coordinator, right? And just to give you a head start, as soon as you open the drive, the very first folder you should go to is the one that says read me first. You open that folder, you see other things inside. You see how to navigate the drive in the first place. You see it inside that folder. it will give you like a map of everything. So that is very important. That is the first folder you should open. So once you do that, I believe that you would not have any issue navigating the drive. And again, thank you so much. Let's walk this journey together. And I believe that together we can make the world a better place. We can take the message of precision medicine, the message of genomics guided healthcare to the nooks and cranny of the planet. Thank you so much, everyone. It's been a very wonderful time with all of us. Thank you. Good night, good morning, good afternoon, depending on where you're joining us, and have a good night, productive day, and a very wonderful time. Bye bye, everyone. Thank you, thank you, everyone. Thank you so much. I see your beautiful messages in the chat box. Thank you so much. 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 Thank you. Thank you. Thank you. Attendance has been dropped. I'll drop it again now for the person asking. I think Muhammad. I just dropped it again now, Muhammad. Great to connect with you too, Summer. Summer, are you still on the call? Can you hear me?
Yes, Destiny, I can hear you. I'm still on the call.
Yeah, great to have you. I reached out earlier on WhatsApp. I think you probably weren't online then. I'm great to have you join us. Great to
Yeah,
have you join us.
yeah, same here, Destiny. Like I was busy the entire day. Like I saw a message really late. So I replied
Yeah,
to as soon as I saw the message. But yeah, like great to have you and great to connect with you. And I'm really
great,
happy
great.
that I could find a forum wherein I can drill hardcore knowledge about pharmacogenomics to the world and also expand my knowledge about it and also
Fantastic.
serve everyone around us to make pharmacogenomics a global ambition and a global opportunity for everyone in the world to make healthcare a better place for each and everyone. So I'm really excited for what stands ahead and very happy to have you by my side and by everyone's side, whoever is on the call and a part of this. Thank you so much,
Fantastic.
Destiny.
You're welcome. You're very, very welcome. I know you've been gearing up for this. I think we talked about this. That was in December, right? We had the meeting
Yeah,
in
in
December, and
December. Correct,
yeah,
correct.
yeah, yeah. So yeah,
Yeah.
it's great to have you. So finally, we're starting finally. So
Yes, yes, yes.
great.
Yeah.
All right. Good night. My regards
Good night,
to
Destiny.
everyone there. Yeah. Good night.
Yeah.
All right. Good night, everyone. So I'll be calling it a wrap now. Have a wonderful day. Bye bye.